Gripper Plus Safety Huber needles are available in both power and non-power needle options and are indicated for use with any implantable access port. Power needles are used with power injectable implantable venous access ports for power injecting contrast media up to 5 milliliters per second and 300 psi. They can be easily identified by their blue tubing and printed clamp inserts that show power specifications. Power needles are available in non-Y-site and lure-activated needleless Y-site, or NAC, configurations. Non-power needles are identified by their clear tubing and are available in non-Y-site, split septum, and lure-activated needleless Y-site, or NAC configurations. Prepare the site for needle insertion according to your facility protocol. Attach a syringe filled with normal saline. Select the appropriate needle length according to the portal location. See the needle length selection sheet for more detailed information. Prime the needle by holding the inserter directly above the syringe and flush upward to properly prime the needleless injection site, if present. Make sure the needle tubing is centered in the clamp prior to clamping. Remove the needle guard from the needle. Palpate the skin around the patient's port to find the portal septum. Hold the needle clip and insert the needle through the skin and portal septum at a 90-degree angle. The needle length is correct if the safety arm rests flat on the base and the needle touches the reservoir floor. Verify patency with blood withdrawal. Flush the needle with normal saline. Remove the needle clip by sliding it toward the end of the needle arm and lifting. Discard the needle clip. Apply a semi-permeable dressing over the needle base. When therapy is complete, carefully remove the semi-permeable dressing from back to front, avoiding activation of the needle's arm. Approach the needle from the back of the base and place your fingers on each side of the base to stabilize it. With the other hand, place a finger on the tip of the safety arm and lift it straight back. Continue lifting the safety arm until the needle clicks into the locked position. Dispose of the used needle in a sharps container. Remember, when priming a needle with a needleless injection site, or NAC, always hold the inserter directly above the syringe and flush upward to properly prime the NAC Y site. When flushing the NAC Y site after a blood withdrawal, use a pulsatile or start-stop technique to flush the NAC Y site thoroughly. Remember to remove the needle clip prior to applying a dressing. Slide the clip toward the end of the needle arm and lift it, then discard. The needle length is correct if the safety arm rests flat on the base and the needle touches the reservoir floor.